Right. Happy Healthcare Simulation Week, everyone. Good morning, afternoon, or evening, depending on where you are in the world. Thank you so much for joining us. Please put your name and where you're from in the chat, just so we can get to know who's joining us in at this time. And as people are coming in, we'll ask them all to be putting their name and where they're from in the chat as well. My name is Amy Copperthwaite, and I have been doing simulation education since 2006. It started first at the University of Delaware in the United States, and now I am doing the position of CEO of Avkin, which is a simulation education company. As the chair of the Healthcare Simulation Week Committee, one of my big desires was to get the information out about the different credentialing opportunities that simulationists have within the community. And so we have three people representing different associations here with us. I want to take a minute to introduce them. We'll go ahead and show a pre-recorded video that each of them have met with me previous to this to do. And then we'll also be fielding your questions. Please place them in the chat as you have them, and then we'll work through them. Either if it's something quick that they can answer on chat, they'll jump in on chat, or we'll do that at the end as well. So again, we thank everybody for joining us, and please put where you're from and who you are in the chat so we can all know a little bit about each other and make it a little bit more of an intimate experience. Okay, so I'm going to begin by introductions. Andrew Spain is the Associate Executive Director for the Society for Simulation in Healthcare. Andrew discovered his passion for healthcare simulation as a manager of the EMS Education program for the University of Missouri's Healthcare Level 1 Trauma Center. He came to Society for Simulation in Healthcare in November of 2010, first as the manager of certification, and then later held titles of the Director of Certification and the Director of Accreditation. So he's very well qualified to be here with us today. Andrew is currently working on his PhD in education at the University of Missouri with an emphasis on educational leadership and policy analysis. Paul O'Connor is here representing ASPIH. Paul is a senior lecturer and associate professor in primary care and human factor psychologist. He is the research director at the Irish Center for Applied Patient Safety and Simulation and the co-director of the Diploma and Masters in Patient Safety and Simulation at the National University of Ireland, Galway. He is a member of the executive committee for the Association for Simulated Practice in Healthcare and the current chair of the Irish Association for Simulation. I'm going to do my best, Marc, here. Marc Lazarovici is here representing SESAM. Marc is an internal medicine doctor, a human factors trainer, and a computer scientist. Currently, he is leading the Human Simulation Center at the Institute for Emergency Medicine Medical Center of the Munich Ludwig-Maximilians-University. He is also working as a trainer in different medical simulation trainings and a visiting professor at UMFST University in Russia. He is a member of the SESAM board since 2016, having served as treasurer, president-elect, SESAM president, and is now in his final year on the board as immediate past president. He's a co-founding member and an active auditor in the SESAM Accreditation Group. So thank you all for joining us. Again, for those of you who are just joining in, thank you for joining us. Happy Healthcare Simulation Week. Please put your name and where you're from in the chat so we can get to know you a little bit better. We're going to go ahead and get started with a pre-recorded video, and we'll be fielding your questions in the chat. So please feel free to add them in there.
You first to comment on what type of credentialing does your program or your association offer with SESAM?
So first of all, thanks, Amy, for having us here and for this conversation about the different quality assurance programs that exist out there in the field of simulation-based education. So SESAM, as a sort of overarching European society in the field of simulation-based education, has quite recently just started a quality assurance program, which we call SESAM Accreditation. And the reason behind this is that we were I mean, there are many solutions out there, and I'm glad we'll hear about a few of them today on this panel. But the reason was that we got requests from our members to have something on a broad European level and in a European way, so to speak, because throughout Europe, centers and policies and healthcare systems and whatnot are extremely diverse. So it's hard to find a program that fits everyone. So these were the requests from our member. And then we did a need assessment, and we had a working group come together and define what SESAM as a society would call quality standards, and that was the result of the accreditation program, which is aimed at educational institutions. So it's not aimed at educators as persons, and it's not aimed at programs as in courses or educational programs generally. It's aimed at institutions. And I'm deliberately saying institutions and not centers, because an institution can be whatever. You can do simulation just in situ and have no center at all, and still you're an institution. Or you can have a huge building and center or whatnot. So that's the diversity we try to cover in this program.
Thank you. Paul, if you could please comment.
Yeah, so I'm here talking for ASPE, and we've been doing accreditation since 2019, and we have 3 different kind of levels or different types of accreditation. So you can be accredited as an individual who delivers simulation-based education. Your organization can be accredited, or a particular program can also be accredited. And this accreditation lasts for 3 years. You have to kind of commit to 3 years of membership of ASPE. That's sort of the payment for this. And then we're just actually, it's funny because we're just coming around again for the reaccreditation. So some of the people that were accredited first, now we have to think about how we're going to do that. But I think we have a process in place. So yeah, we have these 3 different kind of streams. And you might be an individual who's accredited in an organization that's accredited in a program that's accredited. So you can kind of mix them up and mash them up. And so yeah, mostly the organizations that are accredited also have individuals in it who are accredited as well.
And where does your accreditation reach? Is it through all the European countries as well, or is it specific to the UK, or where would you say that your reach goes?
No, so I suppose ASPE is I guess it's more, most of the membership comes from the UK, but I'm in the Republic of Ireland, for example, so I'm not in the UK, and we have members who are not in the UK. So ASPE is trying to become, I think, a bit more cross-European. So it doesn't necessarily have a European focus. We have an organization in Hong Kong that was accredited recently, for example. So no, it's not only specific to the UK.
Okay, great. Thanks so much. Andrew, do you please comment on your credentialing programs that you have at SSH?
Sure. And I'm focusing primarily on our accreditations and certifications today. We have a number of other programs as well that would probably fall under there with, CE accreditation and so forth. But our accreditation and certification journey began back in 2007, and we focused on primarily accreditation first in terms of launching that program first, and that is the organizational recognition of the quality of simulation activities, and of course it's not just the activities themselves, but all of the components within the organization to demonstrate the various pieces that need to be in place, be it staffing, infrastructure, organizational support, all those things that are necessary for the overall program, the simulation program, to be successful and to be able to demonstrate that quality. And our first accreditations were granted in 2010. We have a unique model compared to other accreditations that are out there, in that while everyone has to demonstrate compliance with the core standards, there are a number of areas that you then would apply for depending on your actual activities. And that's our ART-SF model, so assessment, research, teaching and education, the systems integration piece, which is specifically focused on patient safety and healthcare organization safety type efforts, and then the simulation fellows programs. And so that's our accreditation program. And then for individuals, we have certifications, and our first certifications were actually granted in 2012. So we are celebrating 10 years of certification this year at IMSH coming up, which is fabulous, of course. Our primary programs, of course, are our two examination-based certifications, the CHSE and CHSOS. Both of those are accredited through the NCCA, the National Commission on Certifying Agencies, which is quite a hallmark to have for our programs. But it's been fascinating, of course, to have those two programs and see all the individuals from around the world who have become certified, and also with our advanced portfolio based certifications once you've achieved those two initial certifications.
Great. Thanks so much for sharing. So Marc commented a little bit on this. So I'm going to go to Paul first and give Marc a second to think if he has anything to add to this. But initially, why did your association decide to move forward with your credentialing program? What were the needs, or what were the things that you identified as important to institute this type of credentialing?
I think what happened was, just looking back into the history, so I wasn't a member then, but we came up with the standards, I suppose, for simulation-based education. And I think the next kind of logical step to move from those standards is to use those standards to support our members to either, to demonstrate their expertise, or help people to consider what they need to do in order to demonstrate their expertise. So I think it grew from our standards into, now we want to accredit our members against these standards. And of course, our members wanted this because it's a badge, or it's some demonstration that you have some idea of what you're doing when it comes to simulation-based education.
Yeah, and that's really kind of the natural progression. If you look at the growth of an industry, that it starts with, people, those innovators trying to get started, and then really having those innovators move into an opportunity to develop standards by doing research and looking into it, but then adding that credentialing piece onto it. Andrew, could you comment on your thoughts as to really why SSH got started with the accreditation and credentialing?
I think it mirrors a little bit of what was just mentioned, but a lot of our starting point came down to the decision by our board of directors to create the programs as a service to the healthcare simulation community. That's sort of been our approach to all of our programs as we've developed these, because we've needed to have standards developed. Back in 2007, again, at that point, I don't think there were any standards that existed, or they were very nascent, depending on which organization was working on which piece, of course. And our own surveys, when we were developing certification, identified really interesting data, such as 86% of the respondents saying that they were learning on the job rather than actually measuring up to a known framework for what performance looked like. And so that was really important for our board to say, look, there's a lot of things that need to be done to sort of help solve that problem. And accreditation and certification clearly are two very important pieces to it, not just to help set those standards, but frankly, to develop the profession as a whole, for healthcare simulationists, and to be recognized as such. And I know we'll talk about a little bit of that later on, but that's where we started our journey.
And from someone who started in 2006, before there were many standards or any credentialing out there, and I think the other interesting thing with Simulationists is most of us started as one-man bands, where you didn't even have another faculty member to measure yourself against, or another person to go and talk to, unless you were reaching outside of your own organization. And so to really have this opportunity to have a benchmark or a measure really, again, added credentials to what you were doing, but also gave you some validity within your faculty at your own university, because everyone was trying to figure out, and of course we had difficulty with buy-in. So having that really did add an extra measure of validity just for your own mental well-being of, am I doing this correctly? Am I, meeting these students' needs to the best of my ability? And are we offering them the best educational opportunity that's out there? So again, from being someone early on, I definitely can empathize with that. Marc, do you have anything to add to this? I know you already talked about your needs analysis and your community asking for it, but is there anything else that you wanted to add in to that question?
Yeah, I think, although I addressed this before, I think it's very important to see, and this came out from our needs survey, basically. Why did our members seek a quality assurance program. And what came out was that mainly they needed it in order to demonstrate adherence to certain quality standards, demonstrate it to their university, to their funding bodies, to whomever was asking, yeah, you're doing simulation, but how can you demonstrate you're doing it the right way? And so this was the basic need for it. And I would say this is also what the program is focusing on.
Great, thank you so much. Andrew, can you kick off the question? What, if any, unintended benefits has your association identified with your credentialing program?
Certainly, and obviously we expected things like improvement in quality of simulation and so forth, but it's been really fun to see what feedback we receive from our programmatic and individual applicants, and just to hear their stories. And I think one of the things that's been really fascinating on the accreditation side is I think pretty much every program without exception talks about the how important the self-assessment and accreditation process has been, because it obviously is quite comprehensive. It covers so many different areas of performance. There's outcomes that are required to show that you're measuring yourself and how you're learning from it, all these sorts of things like this. And it's really fun to hear all the programs talk about how it was a great opportunity to evaluate where they are, identify the stuff that's going really well, because a lot of things are going to be going really well. Frankly, every program is going to find some areas they're not so happy about. That's normal, of course. And so we approach this as a partnership and help them both identify those areas, and then through the review process with our peer reviewers coming in and helping them out, help identify potential ways that they can make recommendations for improvements, actually evolve their processes. So when they come up for reaccreditation a number of years later, they can show, hey, we've had some success in those areas now. And it's just been really interesting to hear everyone talk about how valuable that process was. Because it turns out the other layer of that is that now you're getting the team involved, because a lot of times programs start with, as you mentioned, just one or two people. And so they sort of know all the inner workings, but to become accredited, you really need to have everybody involved. And when I think, especially from the organizational piece, when our reviewers are there and you're actually having time in front of your organizational leaders, your vice president, your CEO, again, there's so many different mechanisms for what that's called in a particular organization. But you actually get that really high profile in front of those high up leaders that you may have very little time with, if anything. And our reviewers can really promote the amazing work that's going on. And so a lot of these layers of really cool things that occur through the accreditation process. And it's really fun to see those sorts of things as well. Even getting extra staff out of it, because we can always, almost everybody without fault, it's like they never have enough staff. And to be able to say, look, they can do so much more if you just give them a little more staff. For certification, I think we get a lot of different stories from the individual perspective, of course. Anything from our operations specialists, we've had some talk about, suddenly they have a credential and now they're perceived as having the knowledge and expertise and have a level playing field at the table when talking about simulation, where previously they didn't. That type of credential really makes a difference to their actual position in the process. And that's really interesting to see that kind of thing. We've seen organizations rewrite their job descriptions to match up to the examination blueprints and all those KSAs that are listed in the examination blueprints. And sometimes that has actually led to a reclassification of the job and actually an improvement in salaries, which is just absolutely amazing. Not something that is a design of the program, but to see those kinds of outcomes is really good, obviously, for the individuals involved, and frankly, really good for the industry as well, the whole, all of healthcare simulation.
Thank you. Marc, can you share some of, if you have some to share as far as unintended benefits or side benefits that you've learned along the way through this process?
Well, yeah, thanks for this thought-provoking question, because I would say there are mainly two things. So the first one is that we got a lot of feedback that through the process of going through accreditation, already centers or institutions identified a lot of points that they immediately addressed and improved upon without waiting for our feedback and whatnot. Just by reading the questions and by thinking about the answer, they were like, maybe this could be done better. And so this was kind of an unintended consequence, but it was very nice to see. And the other one was really to see that we got a lot of feedback and interest also from outside of what we would, let's say, traditionally call Europe, and where we expected our members and the interest to be. And this posed a whole lot of new challenges, because when we designed the process, we didn't design for traveling to, I don't know, to Mexico or somewhere. And all of a sudden it was, that was also an unintended consequence, and we're still dealing with that one. But I would say the main part is really that going through the process enables institutions to learn just by going through the process.
I would agree with that for sure. Paul?
Yeah, so I certainly agree with all of those points. One of the things we've been doing more recently in our accreditation, so once we've kind of gone through it, we actually ask the organization, is there anything they would like us to put in our report for them to share with their higher up? So if there's something, if they're looking for more money or more equipment, so we can go through the accreditation thing, and then we can put some stuff in there that maybe helps them do what they want to do or get where they want to go. So we've started doing that, and I think that's actually quite useful. So in addition to the report, they kind of get us, an outside organization, telling their bosses that they need more resources or something like that. Another unintended consequence is that it's led us to kind of, because we keep trying to apply these standards, it's led us to identify that we need to change our standards actually and update our standards, because as we try and apply them, maybe sometimes that isn't that easy. So we are just about to start a whole process of updating our standards, and part of the reason for that is because of when we kind of operationalize them and try and use them for accreditation, we can see that actually they need to be changed and they need to be updated.
That's great. And from someone who has gone through the credentialing process, both programmatically as well as individually, I think to comment on Andrew's point of it being a huge growth opportunity, you do sweat as you are going through the process, but in the end of it, you're so thankful that you did, and you have that personal growth. One of the things, if you'll indulge me for just a second, one of the things that I noticed within our institution was it gave us the opportunity to pull out and dust off that policy and procedure manual and say, what's missing? What's missing in here that we didn't have in here? And I think that's kind of to what Marc was saying of like, we can make some improvements before we even go through the accreditation process or go through the review process. And I will say for all of you, it really does help when you are explaining to leadership why we need more staff, or why we need more faculty, or why we need more equipment or space or whatever it is, and the opportunities and the possibilities. And I think as simulationists, we all see each other locking arm in arm, but somehow somebody coming from a different institution with pretty much the same credentials as somebody that's going through the process, saying the same thing that person at the institution has said for years, it gets heard, it gets listened to, it gets evaluated. And I think that that's really important as our viewers are considering the accreditation and credentialing process. It's not just the rigor to prove that you're doing it well, but it's also to really give you the legs to support what you need to do into the future. So I would add those two pieces as well. Number 4, if you could deliver a message to every simulationist about your credentialing program, what would it be? And really what I'm looking for is, if you could tell them anything, what would you tell them? So I'm going to start with Paul on this one.
Okay, so it is a bit of work. I won't lie. I mean, I've been both sides of it. I've been accredited. My organization is being accredited, and I've been an assessor. So it's not pleasant work. And it does mean that you have to kind of scrutinize what you're doing and how you're doing it, and provide evidence for that. So it's very good, like as Amy was saying, for kind of getting yourself, there's lots of work that goes in ahead of time to get yourself ready. But I think it's definitely worth it. I'm applying for promotion. It's part of my promotion package to my university. So I think it's important, particularly when people don't know what simulation is. So I think we need it. It shows a kind of professionalism. It can give some confidence that you know what you're doing. I guess when you go to talk to other people, if you're accredited, they have some confidence in what you're doing. So maybe as we start to kind of collaborate and work together, you know, if it gives some level of confidence perhaps in who you're working with. And yeah, it's definitely useful when you're seeking money, seeking promotion, wanting more, to demonstrate that you know what you're doing. You're not just making this up. And I think for people new to simulation, it provides a bit of a framework for how they need to, what they need to do in order to become a kind of competent simulation-based educator.
Thank you. Andrew?
I would definitely second that all these are worth your time and effort as an organization or as an individual. And you know, my one thing I would want to say to everyone who's listening is you really should get accredited and get certified, because these are such important pieces of the puzzle to not only grow healthcare simulation as a whole, but to grow yourself as an individual, to grow your organization, and that really supports the great work that we do in healthcare simulation and why we are all here doing this, because you know, we make a difference in the outcomes for those learners and then for our patients in the future. So just go after it. It's hard work, but it's absolutely worth it.
Thank you. Marc?
Well, if I were to deliver a message to anyone looking at our accreditation program, I would first and foremost say, be prepared for it in terms of take your time and be aware it will take a toll on your time to go through it, and read the documents, and after reading, decide whether it's for you or not. Don't just go for it because it sounds good or something. Read it and check, is this something we would like to do and go through? And then, yeah, be prepared for quite a bit of work and quite a bit of searching for documents and seeing whether they fit or not and stuff like that. But in the end, be sure that showing that that certificate to your superiors, to your university, to your funding bodies, will make it up for it. It will be worth it.
Great. And one thing we did at our institution, and I don't know if it's the same in Europe and the UK, but we negotiated part of our workload. So when we went through the process, we said, you know, this is going to be a tough process. It's going to take some time, and it is a team effort. We had people from the dean on down involved, but the people that were predominantly responsible to answer most of the accreditation standards negotiated a portion of their workload in that year in order to get it accomplished. So it is something where it really does take some time, and you do want to take it seriously. But you can consider that. Is workload, is that the right word in the European UK market for that? I don't know if that's the right way to put it.
I think it is the right words, but yeah. I wish my organization would have given us some time. They don't care. We did it for us, I guess. I don't think their organization knew enough to give us, it's good after the point. They like the fact that we've done it, but yeah, it is workload. And yeah, I guess if you can get your organization to carve you out a bit of time to do it, more the better.
That's good to know. Yeah, I mean, it came from the leadership down of, we want you to go through the accreditation process. So then we were able to negotiate it. So I guess it just depends on, you know, who's initiating it. But I guess in the end for you, Paul, you mentioned you're going for promotion. So it does help in the long run, even if it is something where you can't negotiate it for workload. Number 5 is, in your opinion, how does credentialing help a greater community beyond healthcare simulation? So how, as you're thinking about the greater good, how does accreditation or credentialing help that? Marc, I'm going to go to you first.
Thank you. I believe this is a very relevant question, because many times people ask themselves, are we going through this just, you know, to have a sheet of paper to put on our wall, maybe next to other sheets of paper, or does it really make sense? And I believe in a world, in a system like healthcare, where more and more attention is paid to quality of whatever is provided, be it healthcare or care to the patient, education, whatnot. I think in this world, it is very relevant to be able to prove that your activities are up to a certain standard defined by some, let's say, body perceived as experts, whoever that might be, which organization. And if we are going to do this in education, this is my, let's say, my broader vision. If we provide good education, and I do believe that providing education according to standards set by a body of professionals is good education. If we're doing this on a broader scale, then we will end up with better professionals, and better professionals will definitely help the community at large and the system at large. So that's how I would see accreditation or certification helps.
Right. Paul, could you address that question, please?
Yeah, I mean, like, we know this. When we're delivering simulation-based education, we're pulling healthcare workers off their day job. They're not looking after patients. So we need to ensure that when they come to us, or when they come to our members, that the training they're being given is the best possible training we can give them, because the cost, the time that's required to do this. And so I think the credentialing ensures that we are delivering training, and the people there know what they're doing. And that's reassuring, I think, to the patients, to the providers who are spending time coming there, to us, and also for the seniors who have to sign off on people leaving their jobs to come to train. So we only have them for that short period of time. We've got to be doing a good job when we've got them, and I think credentialing helps to support that.
Oh, I'm sorry. Thank you. Andrew, your turn.
Yeah, I think what I have to say probably echoes much of what you've heard here. When we look at our credentials, accreditation and certification, we recognize that everything that we are building through our standards, through our processes, whatever it may be, for each of those recognitions, it's all about ultimately the patient-centered focus, because that's anybody who goes through healthcare simulation is going to end up in some way affecting patients in the future. And if our simulations aren't done well, that carries on through to the patients, and of course the risks of poor outcomes for the patient. And so it's really important for the credentials to have that in mind. And I think I look at what we've done and said, look, we got to keep the patient in mind no matter what we do. If somebody comes certified or accredited and it's just a piece of paper, then it hasn't achieved the desired outcome. And so having that patient-centered focus as the end goal really establishes why it's so important to have these done and done well. So that way, when people go through the processes and spend the time to become accredited, to become certified, it has a meaning and has obviously a beneficial outcome to the patients at the end.
And I would say it's something US-based, but the National Council of State Boards of Nursing did a research study, and they found that up to 50% of clinical time could be replaced if good quality simulation is being done. And it would have no effect on the learner or the student in this particular case. And I think that that's the qualifier, is that we need something to ensure that the simulation programs that are using or potentially using this for a clinical replacement, or as I think Paul mentioned, bringing people from, that are already licensed and coming down to do that it's good quality healthcare simulation that's being done, so that the outcomes are what we expect and are meeting those standards. So thank you all. The last question that I wanted to broach with you all is many regulatory bodies for health professions. So if you think of whatever credentials, a medical school or a nursing program or a hospital, still recognize simulation as a new or novel educational modality. In your opinion, how does our collective credentialing work to speak to the efficacy of healthcare simulation? And Marc, I'm going to start with you.
Okay, thank you. So while the statement that opens this question is true, I'm always a bit surprised by it, because calling simulation a novel teaching method is, well, anyway, it's not. We all know it has very deep roots, and you don't need to look into ancient history, but we've been doing it all the time. But they are looking at it as novel, and I think that does have some advantages, because you always, when you come and say, look, we are going to offer standards for this now, they are saying, oh yeah, this is needed, and instead of telling you, yeah, but look, we have standards for education like for 100 years. So I think this does offer some advantages to us in the community, and I believe that creating standards or levels of quality, that leads to the whole field being recognized as truly professional, although we were all the time. So I'm not saying we are getting professional, I'm saying we are getting the recognition as professionals. And so I think these two parts play together and, well, make the statement, I'm working in simulation-based education, more like, oh yeah, that's a good thing. It makes you more a recognized professional by having these standards.
Thank you. Andrew, I'm going to ask you the same question.
Certainly. And I think there's a lot of pieces that I see that what we have done and what all of our organizations have done, it does create that consistency to be recognized by those external bodies, because there's so many things that of course go into becoming accredited and certified. Now you're demonstrating that high quality simulation actual practice. It's to the standards. You've been measured by an external set of guidelines, and that gives confidence that your healthcare simulation activities, your use of healthcare simulation for research, taking simulation as a concept and saying, how are we going to support patient safety efforts by recreating what went well in a hospital and what maybe didn't go so well in a hospital. All these things suddenly become more important and become more recognized. With CHSE, it's been recognized as a magnet designation, and of course that's a U.S.-centric organization that recognizes high-quality healthcare organizations. But to have that credential as one of the pieces of evidence that those hospitals can submit shows that we're getting embedded in those healthcare organizations. They're seeing why accreditation and certification are so important. And I think the other piece of it, of course, is that as you see the growth of the programs over the years. I mean, we have 237 programs in 24 countries that are now accredited, and almost 4,000 individuals in 43 countries who are certified. You're going to see that it's going to be recognized. And of course, all that doesn't include all the numbers from everybody else that's doing all this work. And these other organizations can't help but take notice, because it has been an effort to improve healthcare simulation as a profession, as an industry, and just to grow us all, where we're now again sort of recognized for the amazing quality work that we do and how it promotes that patient safety and improves our learners and our outcomes and all these wonderful things.
Thank you. And Paul, I'm going to give you the last comment of the panel discussion, and we'll move to questions and answers after that.
Yeah, I mean, I don't have much more to add. I mean, I think it gives us some kind of professionalism. It shows that we're not just cranks in the corner of a hospital doing weird things with dolls. We are doing this as properly. It's based in theory. There's demonstrated evidence for effectiveness of what we're doing. We're participating in quality improvement, after action reviews. There's so much that we can do to help improve patient safety and the delivery of care. So I think it's just it's bringing that professionalism to what we're doing, and it's demonstrating this isn't just stuff that Paul O'Connor thinks is a good idea, but this is how we should be doing work. You know, simulation is not a nice to have anymore. It's become, you know, this is something we must do, and we must do more of it. And I think with the accreditation, it's starting to build a proper professional kind of support network around that.
Thank you so much. I agree with all of you on that. I think that what my secret hope is that people from some of these regulating associations will watch this webinar and we'll see that we do have some really valid credentialing opportunities, and they can begin, as Andrew mentioned, like the magnet program, adding some of these requirements in the credentialing for different programs and organizations, depending on whichever one it is that your program is associated with. So as we move into the question and answer section, I would like to ask our audience to put questions and answers into the chat, but also if the three of you would have the link to the information for your credentialing and put that into the chat as well. So anybody that's watching and wants more information can get that. And we will move into that very shortly. Thank you so much for your time, your talents, your inputs. This has been a really lively panel discussion, which is what I had hoped for. So I really appreciate it.
All right, great. Thank you guys so much for that. Mark, I apologize that I said Russia instead of Romania. I didn't realize I did that. I will just attribute it to the fact that it's 2 o'clock in the morning, or actually 3 o'clock in the morning here in the US, where I am, and I am still half asleep. So I apologize for that. There were some good questions that came into the chat. One of them associated with the cost of accreditation and certification. And I didn't know so I'll just read the question out loud and ask the three of you to comment on it if you have something to add in. One of the barriers to accreditation and credentialing is the cost implication. What solutions or ideas do you have that institutions or trainers in LMICs? I don't know what LMICs stands for, but do you guys have any thoughts on how to address the cost barrier or potential barrier for institutions and the trainers in those areas?
Maybe I'll jump in first. So to my knowledge, LMIC is low and middle income countries. There is a World Bank or WHO or something list which you can look up where your country is sitting. Anyway, so yes, this is a very true thing. Accreditation implies a lot of work by a lot of people, and that does cost. And I would say there are efforts to reduce costs depending on where you go. The fees may be higher or lower and stuff like that. But still, if you have people fly in, do an audit, a site visit or something, these people usually need to be paid, unless you find some agreement of voluntary work. I'm not sure I have a good answer on this, really. Maybe the most important thought should be that these costs might be offset in the future by you having that accreditation and thus getting other funds instead of not having it and not getting the funds. But that's a very vague answer, I know. Maybe my colleagues have other thoughts on this.
From a ASPE perspective, the cost of accreditation is actually very low in our organization, and we got out of the habit of doing site visits over COVID, and actually we've continued doing kind of online visits, and we have people to do a walk around, and show us a video of their sim center, and then we get the people together and we talk to them. So I can't speak for the other organizations, but one of the ways of keeping down the costs is for there not to be a site visits. And so we've kind of worked around that. So even in the UK, we've been doing our organizational visits without visits. So it maybe, I don't know, I guess you can talk to the organization that you want to get accreditation from and try and work something out with them.
I think I would have to echo some of what has already been stated. A couple of other things to add beyond the reality, of course, that becoming accredited, unfortunately, it does have a great deal of costs associated with it in many cases. There's a lot of ways that we have seen programs actually develop partnerships with organizations in more wealthy countries, and so that's helped with the finding funding. I know there's been some grants that have actually supported applying for accreditation. Just as what Mark said, we've actually seen programs that now are in a lead position once they have been accredited to obtain funding from their own country, from the region, for projects, for different activities. that might be going on. And so it does create that additional streams of revenue down the line. Of course, those are no guarantees, unfortunately, but it is interesting to see some of those changes to the organization and what now becomes available to them once they're accredited.
Okay, thanks. One thing I also would say is if you do have a relationship with a particular vendor, I know that that we at Avkin, the company that I'm the CEO of, we do support and give away the payment for a credentialing process to help to offset some of those charges. I had, and I do speak from a wealthy nation, so I fully acknowledge that, but I didn't realize that certain institutions did not pay for people to go through that credentialing process. And so from my heart, as a simulationist that is running a company for simulation, it is something that I wanted to offer other people the opportunity to go through that and get their certification exam, because I think it's so important. And if it isn't something that's being subsidized by their institution, that we as a vendor are supporting and encouraging people to go through that certification process. So again, I don't know if other companies are doing that, but it is something to put the word out to say, hey, is this offered, because that gets back to people in leadership within the companies, and then they may be offering something along those lines as well to help offset some of those things. But I'm sure that people in lower middle income countries also struggle with finding vendors that might be supporting that as well. But I do like the idea of having partnerships, of being honest with the association that you're trying to be accredited with, to say, look, this is a financial burden for us. We'd like to work with you on this, and how can we do so? I think that people in the simulation community are so excited and anxious for institutions and individuals to go through a credentialing process, that they're going to try to work with you to help offset some of those costs, or to try to, help them find some grant resources to be able to do that. I love that we have people from Ethiopia and Kenya and Indonesia on here. Please, if you haven't put your name and your institution in the chat, let us know where you're from. It is, I know probably if you're from that country, you don't realize how excited people from the United States get, or from Europe get, about being able to interact with people from all over the world. But it really is exciting to see the breadth of simulation being passed around the world, and people getting excited about simulation in very different places that we've heard of before. So thank you all for joining us, and please know that we're here to support you through this process. Another question that came through is, do the accreditation boards require some type of fancy equipment or high fidelity mannequins? I think that you guys answered some of this in the chat, but I want it to be said out loud so that it is recorded for the webinar. But if you could comment on what type of equipment is necessary, what type of technology is necessary for your institutional accreditation. Andrew, I'm going to let you speak to that first.
And just to double check, I was typing an answer for a different question, and
Sorry.
you're talking about the high fidelity mannequins and things like that, correct?
Yeah. What do you require? What's the tech that's required to go through accreditation?
Actually, fairly minimal. We actually have programs that have become accredited that have just test trainers and/or standardized / simulated patients. It's all about the fundamentals that are essential to high quality simulation: performing needs analysis, identifying the activities that need to be developed based on the objectives that are identified, performing evaluations, supporting your learners in what ways you can with the resources that you have on hand. You don't need big AV systems. Obviously, there's a lot of benefits to having those, and the automation that can sometimes come in with those, but the need for video is identified again through the educational design process and how you're going to utilize that. So a lot of things can actually be done for very low cost, low resource type of approach, and really do amazing simulations through that. It really can be some frankly cool stuff that we have seen. all over. And I think you'll hear probably the similar story from Marc and Paul as well about, it's definitely important to have those mannequins when you can, because there are certain things that you can do with them which you can't do with others. But there is so many great things that you can do without having to spend a great deal of money.
Yeah, I know I was in Sweden and they had basically a long table and they had just a piece of paper that had the front of a body on it. And on the back of that laminated sheet was the back of a body. And they did basically paper simulations, but they were standing around it. And, did they turn the patient over to see the knife wound in the back and things along those lines? So you can do a lot with very few resources. And that was laminated. So they just used a dry erase marker, erased that piece of it, and then started again with the next simulation the next day. Again, it's not high fidelity mannequins. You're not going to be using anesthesia machines, but it is something to really, again, it's something to begin. It's something to start with. So it doesn't have to be high tech. Simulated participants are my heart and my expertise. So love talking about that. And they can be pricey if you're paying them, but there's other ways. We have volunteers opportunities. You have people who have retired from retirement and want to have some type of really practical input into the healthcare system. There's ways to utilize simulated participants, train them, I've met with people all over the world, give them lunch, every once in a while, and they just appreciate the fact that they can come in and interact with people, and especially younger people, they really enjoy that interaction. So there are ways to even do simulated participant experiences very affordably that show great value. Again, I've spent my life's work is on how to integrate simulated participants as much as possible in simulation. So love to talk about that as well. Marc and Paul, I'm going to ask you to comment on the question about high fidelity simulators.
Yeah, I mean, it's like just because you have the best bicycle doesn't mean you're the best bicyclist. Just having high tech equipment doesn't make your simulation program good. I mean, thousands of years ago, people were using simulators made out of clay to depict people. So this is not this is nothing new. It's not about the tech. It's about what you do with the tech. Like I said in the chat, it's just a prop. The prop could be a doll. It doesn't matter. It's what you do around that to build the simulation that's most important. So I don't think not having high tech equipment should be anything to discourage anyone from either doing simulation or seeking accreditation.
Yeah, I can only fully concur with this, and I very much like the bicycle metaphor of Paul, and that's really what it is. SESAM is also not looking at what you've got and counting it and rating you based on that. It's really what you do with what you've got. And yeah, of course, I agree with Andrew. Some stuff helps doing maybe smoother education, but if you don't have that stuff, whatever it is, then it's in your inventivity, in your way, in your creativity, how you create that education, and that's really what we're also looking at. So I'm glad to see we all agree on this aspect. It's really not about technology.
Great, thank you very much. We have one question here saying that they do have a high fidelity mannequin, but administrative work and the curriculum development is their problem. And how can they solve that problem, to go forward with credentialing? So I don't know if one of you wants to just grab that question and we can put it out to all three. We'll start with Marc and then go to Paul and then Andrew, just to make it so that you guys are talking over each other.
Okay, thanks. Then I'll go first. We did have some comments on this in the chat already, and I think that's what to do. This is, in my experience, the most common problem centers people face, because maybe you get a local funding, you buy some stuff, and then you're like, okay, now we've got these fancy boxes, or maybe we took them out of the boxes, but what to do now? And that's really, I think, the crucial and critical point, because as we said, the boxes or the content of the boxes will not teach anyone. It's the people who teach. And I think that's the moment when you should look around. And with around, I mean widely around. Talk to your maybe neighboring city. Maybe they have a sim center. How did they do it? Talk to someone across the world. How do they do it? Get in partnership with other centers. In my personal experience, if you write an email to someone really anywhere in the world doing simulation and tell them, hey, I'm this and this, we're just starting, can you give me some helpful hints? You will always get a friendly answer. And if you say, hey, I'm in your city, can I visit? Yeah, of course, come over, visit. We'll show you our center, we'll show you everything. That's the spirit I experienced, at least. So I would encourage anyone to do this. Now with the Zoom and virtual stuff, it's even easier, you don't need to travel anywhere. Get in partnership, get into information, LinkedIn was mentioned, whatnot, do that and you'll get a lot of information, and then get your people, get a good team. And I'll leave the rest for my colleagues. Sorry, I'm rambling around.
Paul, do you have anything to add?
Yeah, I mean, I would agree. I think simulation people, everybody kind of struggled at the beginning. So I think people are very, maybe more open actually than in some other kind of domains of things to sharing and sharing their thing. You know, people don't charge for this stuff, but I think, yeah, link in with people locally, try internationally. Go on courses if you can. Come to all of our organizations have annual conferences. If you can go, then go to them. My university, I don't want to plug my university, we run a master's and a diploma in healthcare simulation. There's more of those kind of coming on stream in terms of if you want to get kind of postgraduate qualifications. I think just don't be shy and don't sit there and stare at the box. You need to talk to people.
I would 100% agree. We all sat there and stared at the box at one point or another. So just know that you are among friends. There's no judgment in any of this. We made a lot of mistakes before the standards of best practice came out. So we've, you know, I had one student that I think I emotionally traumatized one time because I didn't realize the importance of psychological safety. And so, you know, those are the things where if we want to help people avoid that and help people get started, and have been in your shoes before. So do recognize that. I agree. I think simulation is one of the, especially in academia, most people are keeping things very close to their chest and hiding it. And I think in the simulation world, we're like, here's what we did, and this was successful. Our students loved it, or whatever the case may be. We love to share, and we love to help. So Andrew, I'm going to also let you comment on that as well.
I think the only thing to add is to use those things such as networking and obtaining tools from others, and just build over time. There is no expectation to have every single thing completely aligned, because we know things change over time for your simulation programs. What we're looking for, and I expect you'll find that with Marc and Paul as well, is that you have that growth of your program over time, that you're doing more and more things with the higher quality that you have identified over time as you build your curriculum, as you grow your programs, get more staff, get more administrative support, more administrative staff, all these pieces that are essential, again, to great healthcare simulation. And so you just start somewhere with things that work for your program. And there's lots of templates, lots of curriculum ideas, lots of ways to design and do debriefing for simulation activities. Pick what works best for your program that best suits your learner populations, and just keep building and building, and have those quality fundamentals now start embedding in every single thing that you do from here on out.
Yeah, and I would say the good news is that there are standards of practice out there now, and there is plenty of opportunity to learn right from the beginning, rather than those of us who kind of were fumbling through it in the beginning. And I think that the resources that we've talked about here within the webinar are really meant to encourage you and to get you excited, but also to be a resource into the future as you are building. If you are building a new center, you're not necessarily ready for that credentialing process immediately, but it is something to be working towards if you have And I think you all shared some templates in there, or where you could find the templates for accreditation. It gives you something to be working towards, so that as you are building your sim centers, you can, know exactly what, building it from the ground up correctly, the right way, and you can build slowly. It's okay. There's no pressure, that within 2 years something has to be done. But there is many people in the simulation community that are very open to helping and giving advice, and really recognizing the efforts of people who are just getting started, and empathizing with them in ways, bringing them back to when they first started in simulation. But it's a wonderful journey, and I highly recommend it to everybody. Yes, Marc, thank you for reminding us. Happy Healthcare Simulation Week. It is something that we want to celebrate what we're doing. And please feel free to join us on the other webinars. We started these international webinars to help people who are from different time zones. So we appreciate you all joining us, and it is exciting to see such a great turnout of people for this event. So thank you very much. And we're going to conclude this webinar now. It's right at the 1 hour mark. Have a great day, everyone.